What would you like to see done better?
I think where we have to come from is that the vast majority of NHS staff don't go to work to do a bad job. But sometimes the way that the systems are set up or the circumstances that they have to undertake their role in don't help them to do as well as they could do. So it's about identifying things we could do better and listening to the frontline staff to shape services to make sure we deliver patient-centred care.
We perhaps don't use our time as effectively as we could and therefore waste resources, particularly with changes in junior doctors' hours. We spend a lot of time handing over and that seems to lead to a lot of inefficiency.
Do you find a similar thing, Dr. Steve?
Well, I think we've got a wonderful NHS. I think as it's developed over the last 62 or so years, we can really be proud of what we've got. And of course, we have the best general practice in the world. What we have to do is really look at how we move resources and care closer to patients. And we're going to have to take some very difficult decisions. We have too many hospitals, and we have too much activity going on in hospital without a real imaginative change in how care is provided, moving care closer to patients in their homes, pushing general practice to deliver more care locally, then I don't think we're going to be able to answer all of the difficulty questions that are coming.
Anita, let's hear from you.
I think one of the issues, one of the problems is sort of communication really, and mostly communication between medicine in the community, so general practice and hospital sort of medicine really. I think there's somewhere along the line information doesn't get passed on, which obviously is inefficient, so lots of things end up getting duplicated, so investigations get duplicated, and similarly the other way as well, so things that get done in hospital for patients don't always get relayed back to the general practitioners.
So what is working at the moment? Maybe that's a better place to start.
Some of our specialist hospitals are leading the international expanding knowledge. You know, we've got some fantastic examples. We've got Birmingham Children's Hospital on our doorstep. We've got the specialist orthopaedic hospitals. You know, we've got some wonderful examples of NHS leading the world and pushing the boundaries of medical knowledge.
I think one of the things that's really working and doesn't get enough credit is the investment in IT. It's had a really rough ride, and I absolutely understand why. But from general practice has been computerized for years, and it's just inconceivable to think that we could practice without that. And now you begin to see the bits being joined up with pathology and X-ray arriving, and in the swine flu, the way the swine flu services were handled, as an example, between public health, between primary care, between secondary care, there was an awful lot of infrastructure there that was going on to glue all that stuff together. And I think that's going to be the backbone for the kind of thing that Steve is talking about, to actually move complex care out into the community, so I can talk to Anita and so I can talk to Ruth as I do that stuff, with really great IT backing it up and the record holding it all in common.
Okay, let's move on to question number 3 then. And what can be done better to prevent people becoming unhealthy?
Well, it's all about education, I suppose. That's where it comes down to, and it's about educating people in the community. So it's people who know that they're unwell, so not with acute things, so people who have chronic illnesses that are perhaps not debilitating, but it's educating them, somehow getting to them and teaching them what they can do to prevent themselves from getting worse, and also from recognising when things are getting bad for them, to stop them from getting to the stage where they need to come into hospital. But it lies in various forms of education, so not perhaps just leaflets and pamphlets, but in other ways, so maybe in terms of media, etc. And it's about targeting the relevant groups of people as well, and the relevant cultures and things like that, really.
I think you have to use the different media and different ways of getting into the different parts of society. So working with mosques and with temples, with churches, with youth clubs, using television. I mean, I still am really worried about how you have smoking amongst these so-called glamorous actors and actresses on there. We need to really use the media to really get underneath the skin of people, and at the same time make it much easier for people to eat healthily and not smoke.
Are you putting a large portion of the blame on the media then? Are you saying it's largely down to the media? You see, I choose to differ here. I think it's not just the media. I think it's much more than the media. I think it's got to start from parents. They've got to take a lot more responsibility for this aspect of it.
You've got to make it easy for the parents And at the moment, if you go home and take your children home tonight, you will see advertisements for foods right the way through the early evening. And the role modelling of people eating these junk foods, which will harm them in the long term, that should stop.
Yeah.
I was at a local radio station, and they'd just won a contract with a local primary care trust around chlamydia screening. And they are going to put on a free gig for 4,000 young people, get them all in, and the entrance ticket is a urine spec and a form. Okay? That's all they have to do. And you've got 4,000 people opportunistically screened. That's great. And that's working with people, and let's make it fun for people so that they actually do it.
That's a great example of my next question, really, and that was really how to implement best practice and learn from others.
There's a growing evidence base there in terms of keeping people healthy. And it's about making sure we implement that, learning from your good practice, learning how to do the opportunistic screening, learning how from other areas and rolling that out across the country.
So we should empower patients, and the organisation that I run, Patient Opinion, allows you to do that. So you can, patients could be told what best practice was and then give feedback as to whether they had it, because they're the people who really are most interested in getting really great practice.
In one sentence then, my final question, what innovations in technology and working practices would improve care?
I think we need to be really serious about the workforce we're creating for the future. We must stop training as many nurses and others in secondary care and train them where they're needed in primary care. We need to be brave and shift the resources into primary care. If we don't do that, we won't have the workforce to introduce any innovations. And this region is leading the way and should be encouraged to continue.
Thank you.
One of the things is we need to have a forum where we can share. There's a lot of places where you can share good clinical practice, so evidence for evidence-based medicine, but I don't think there's anywhere that we can share systems that work. So, you know, you've got a particular problem in how you run a clinic or an area in hospitals, and it's about saying, well, actually, we've done it like this and it works, and it's how we share that information, I think.
Thank you all very much indeed.